Today we're going to talk about the geriatric population. And gerontology is the study of social, mental, and physical aspects of aging. Professionals from diverse fields call themselves gerontologists. The medical field that involves the study, care, and treatment of the elderly is called geriatrics, and a medical specialist in geriatrics is called a geriatrician. According to statistics published by the Administration on Aging of the United States Department of Health and Human Services in 2011, the older population, 65 plus, numbered 40.4 million in 2010. This is 13.1% more than 1 in 8 of the total population of the United States. Older women, 23 million, outnumbered older men, 17.4 million. 40% of older women are widows. Women reaching age 65 in 2010 had an average life expectancy of an additional 20 years, males 17.3 years. The older population is expected to increase to 55 million in 2020. The 85 plus population is projected to increase from 5.5 million in 2010 to 6.6 million in 2020. Most older people have at least one chronic medical condition, and many have multiple conditions. The most frequently occurring chronic conditions among the elderly are diagnosed arthritis, hypertension, all types of heart disease, and any cancer and diabetes. Alzheimer's disease occurs in 13% of older people and accounts for 70% of all dementias. Lifespan is the age to which individual humans aspire to live. In the process of getting there, life expectancy is the average length of life for any given population. Longevity is living beyond the normal life expectancy. Aging is the gradual spontaneous change resulting in maturation through childhood, adolescence, and young adulthood. Changes then cause decline in function rather than maturation through late adulthood and old age. Senescence is the loss over time of the ability of cells to divide, grow, and function, a process that terminates in death. It is sometimes used interchangeably with the term aging. Okay, and these are terms associated with the chapter. Aging and aged comes from the Latin term aging, the process of human maturation and decline, having lived to an advanced age. Alzheimer's disease, after a lowest Alzheimer, common form of dementia. Dementia, ment, is mind. Chronic progressive irreversible loss of the mind's cognitive and intellectual functions. Geriatrics, this term contains two word roots. Ger, old age, iatrio, medical treatment, medical specialty that deals with the problems of old age. Geriatrician is a medical specialist in geriatrics. Gerontology, geronto, is the process of aging, the study of the process and problems of aging. Life expectancy, expect is await. ANSI is state of, statistical determination of the number of years an individual is expected to live. Lifespan, Old English for life, or span, Old English for reach or stretch, the age that a person reaches. Longevity, longev is long life. Duration of life beyond the normal expectation. Senile, characteristics of old age. Senescence, sen means old age. ence, ence, state or quality of, the state of being old. Senility, senile is characteristic of old age, so mental disorders occurring in old age. Senescence of organ systems. Organ systems begin to show signs of senescence at very different ages and do not degenerate at the same time. Most physiologic studies show general peak physical performance occurring during a person's 20s, but surprisingly, autopsies postmortem in children will often reveal atherosclerosis in the artery supplying the heart. Autopsies are usually performed by a pathologist or a medical examiner. Integumentary system changes in a person's 40s. Melanocytes die and hair becomes gray and thinner. The skin becomes paper thin, loses elasticity, and hangs loose, and wrinkles appear. Flat brown black spots called senile lentigines. Age spots appear on the back of the hands in areas exposed to sunlight. Special senses start to decline in the 20s. Visual acuity declines at that time. In the 40s, presbyopia begins, and many people develop cataracts later in old age. Hearing loss occurs as the ossicles become stiffer and the number of cochlear hair cells declines. The cause of Hickman's hearing loss in the case report. Taste and smell are also blunted late in life as taste cells and olfactory buds decline in number. Skeletal system changes appear during a person's 30s. As osteoblasts become less active than osteoclasts, the result is osteopenia, which later develops into osteoporosis, particularly in postmenopausal women. The joints of people in their late 20s have less synovial fluid and thinner articular cartilage, and often osteoarthritis results. Muscular system changes occur with age as muscle mass is lost, sarcopenia, and replaced with fat. As muscle atrophies, there are fewer muscle fibers to do the work. As a result, the available blood supply decreases. Tasks that used to be easy become difficult, such as buttoning shirts and tying shoelaces. Nervous system changes begin around age 30 when the brain weighs twice as much as it does at age 75. Motor coordination, intellectual function, and long-term memory decline more quickly than long-term memory and language skills. The cardiovascular system. Cardiovascular systems always have coronary artery atherosclerosis, even at a very early age. As a result, when aging myocardial cells die, the heart wall gets thinner and weaker, and cardiac output declines. This causes the decline in physical capabilities with aging. Atherosclerotic plaques narrow arteries and trigger thrombosis, leading to strokes and heart attacks. In veins, valves become weaker and blood flows back and pools in the legs, leading to poor venous return to the heart and heart failure. Respiratory system changes are noticeable in the 30s as pulmonary ventilation declines. This decline is a factor in the gradual loss of stamina that occurs as people age. The rib cage becomes less flexible and the lungs become less elastic and have fewer alveoli. Respiratory function declines. As respiratory health declines, hypoxic degenerative changes occur in all the other organ systems. Urinary system changes begin in a person's 20s when the number of nephrons starts to decline. Later in life, many of the remaining glomeruli become atherosclerotic. The body's glomerular filtration rate decreases and the kidneys become less efficient. For example, drug doses in the elderly are generally lower than those for younger people because drugs cannot be cleared from the elderly's blood as rapidly. The immune system functions decline in the elderly as the amount of lymphatic tissue and red bone marrow in their bodies decreases with age. This leads to a reduction in both cellular and humoral antibody immunity. As a result, the elderly have lower levels of protection against infectious diseases and cancer. Specific disorders of senescence and their terminology are described in each of the body system chapters in this book, so don't forget to review those. Visual acuity starts to decline very early in life. Eye exercises can help prevent this normal occurrence. Exercise and good nutrition help prevent osteopenia. Exercise and good nutrition help prevent muscle degeneration. Exercising your brain enhances your quality of life in old age. Exercise and good nutrition extend longevity and enhance the quality of life. Bronchitis and emphysema. The chronic obstructive pulmonary diseases are the cumulative effects of cigarette smoking and are a leading cause of death in old age. The kidneys of an 80-year-old receive only half as much blood as those of a 30-year-old because of atherosclerosis. Because they have lowered immunity, the elderly are advised to receive vaccinations against influenza and other infections. Atrophy or atrophies, the verb. Trophy means nourishment or development. A means without, so wasting or diminished volume of a tissue or organ. Autopsy postmortem. Greek is to see with one's own eyes. Mort means death, so postmortem means after death. Examination of the body and organs of a dead person to determine the cause of death. Lentigo, Greek for lentil, age spot, small flat brown black spot in the skin of older people. Pathologist, patho means disease, logist, one who studies or specializes. A specialist in pathology, the study of disease or characteristics of a particular disease. Sarcopenia, sarco means muscle, penia means deficiency. Progressive loss of muscle mass and strength in aging. Theories of senescence. The causes of senescence are unknown. Heredity plays a role because longevity or early death tends to run in families. Theories of senescence include protein abnormalities. 1/4 of the body's protein is collagen. With age, collagen and other proteins show abnormal structures in their cells and tissues and become less soluble and more rigid. The cells accumulate more of these dysfunctional proteins as they age, and their functions are impaired, leading to senescent changes. Free radicals, these are chemical particles with an extra electron. For example, the stable oxygen molecule has 2 atoms with many electrons. If it picks up an extra electron through some metabolic reaction by radiation or by chemical action, it becomes a free radical. The free radical's life is short because it combines quickly with other molecules that in turn become free radicals with the addition of the extra electron. A chain reaction occurs as more and more molecules become free radicals. Among the damage they cause are cancer, myocardial infarction, and perhaps senescence. They can be neutralized by antioxidants. Autoimmune, altered molecules. These molecules may be recognized as foreign antigens, and an immune response may be generated against the body's own tissues. This theory is helped by the fact that autoimmune diseases such as rheumatoid arthritis are common in old age. Complex effects of aging. The appearance of symptoms of aging depends on the remaining healthy reserves of organs as they decline with age. For example, renal impairment can be part of aging, but renal failure is not. This decline in physiologic reserve can produce complications from mild problems. For example, dehydration and mild gastroenteritis can cause confusion in the elderly, which in turn can lead to a fall and a fractured femur. Many diseases in elderly persons may present with a very vague and nonspecific symptoms. For example, pneumonia can present with low-grade fever, confusion, or falls rather than the high fever and cough seen in younger adults. Delirium in the elderly may be caused by something as simple as constipation. Some elderly people may have difficulty describing their symptoms, particularly if they have cognitive impairment. Therefore, time and care have to be taken to discover the root cause. Many elderly patients take multiple medications, sometimes prescribed by different specialists without reference to other medications prescribed by other specialists. This polypharmacy can result in adverse drug interactions. In addition, most drugs are excreted by the liver or kidneys, either of which can be impaired in the elderly. As a result, the dosage of medications may need to be adjusted to avoid excessive levels in the blood and undesirable side effects. Aging has some benefits and advantages for many people. These include increased knowledge of life, which is wisdom, freedom from many of the day-to-day responsibilities that working adults face, freedom to be gentle and grow with oneself, time to enjoy family, freedom to choose to participate in child rearing for grandchildren or other relatives, increased participation in volunteer organizations. Keynote: people older than 65 make up 13% of the population and use about 30% of all prescriptions written. A study of 27,600 Medicare patients documented more than 1,500 adverse drug effects in a single year. When a physician or nurse practitioner or a pharmacist oversees an elderly patient's medication regimen, drug-related problems are less likely to occur. The elderly patient should bring all his or her medications to every hospital or office visit, including prescription, over-the-counter drugs, and all supplements. ADE is adverse drug effect. OTC is over-the-counter. Antioxidant, oxide is to oxidize. Anti is against, and an ant is a suffix meaning forming, a substance that can prevent cell damage by neutralizing free radicals. Delirium. Delirium is confusion, disorientation. Is structure. Acute altered state of consciousness with agitation and disorientation. Free radical. Free means free. Radic means root. Al is pertaining to. A short-lived production of short-lived product of oxidation in a cell that can damage the cell. Heredity. Hered is inherited through genes. Idity is condition or state. Transmission of characteristics from parents to offspring through genes. Polypharmacy. Poly means many, pharmacy means drug, the administration of many drugs at the same time. Senescence, or the adjective form senescent. Senec is growing old. Ence is state or quality of, the state of being old. The major categories of impairment in elderly people as they begin to fail, the so-called geriatric giants, include immobility, instability, incontinence, and impaired intellect and memory. Immobility, instability, incontinence, and impaired intellect or memory. Immobility is a common pathway produced by many diseases and problems, particularly those that involve prolonged bed rest, immobilization, or inactivity. It can also occur when it is self-imposed, when elderly patients do not exercise to keep limbs flexible, promote circulation, and improve well-being. Many factors influence the elderly state of immobility or are iatrogenic or arising from medical regimens, including institutional policies and resident and staff characteristics in nursing homes. The negative consequences of immobility can often be avoided with careful and vigilant medical and nursing management. Instability or difficulty in balance is often the first problem that the elderly person encounters. The instability and associated falls can result from a single disease process or the accumulated effects of multiple diseases. It's essential to take a careful, detailed history and examination to define all the factors contributing to the instability and to develop the appropriate interventions to prevent future falls. Instability and falling are not inevitable in aging, but are problems that arise from identifiable disabilities that are often treatable. Dementia is defined as the progressive loss over at least 6 months of cognitive and intellectual functions without impairment of consciousness or perception. Dementia is characterized by disorientation, impaired memory, impaired judgment, and impaired intellect. Incontinence is the inability to prevent the discharge of urine or feces. It is common but never normal part of aging. In the nursing home population, some 50% of residents have urinary incontinence. There are 5 main types of urinary incontinence. Urge incontinence, the loss of urine before one can get to the toilet, is the most common form in the elderly. It can be caused by strokes, multiple sclerosis, dementia, and pelvic floor atrophy in women or prostate enlargement in men. Stress incontinence is caused by weak bladder muscles. It occurs when the abdominal pressure when you cough, sneeze, laugh, or climb stairs overcomes the closing pressure of the bladder. Overflow incontinence is rare. It occurs when the bladder never completely empties and leaks small amounts of urine. Functional incontinence is an inability to reach the toilet in time, for example, due to arthritis, stroke, or dementia. Mixed incontinence is usually a combination of stress and urge incontinence. Fecal incontinence occurs in about 1/3 of the elderly in institutional care and is the second most common reason for committing the elderly to a nursing home. It can be produced by local causes such as chronic laxative abuse or muscle damage to the sphincter muscles in surgery or childbirth. It's also been seen in dementia, multiple sclerosis, and diabetes. Impaired intellect that is present for at least 6 months is called dementia. The cognitive functions that are affected include decision-making, judgment, memory, thinking, reasoning, and verbal communication. Dementia is not a normal part of aging, but advanced age is the greatest risk factor. More than 5 million people aged 65 and older have dementia, and more than 500,000 people under 65 have early onset dementia. Alzheimer's disease accounts for 70% of all dementias. It's progressive and there is no cure. Other types of dementia are vascular dementia, frontotemporal dementia, and dementia with Lewy bodies. Delirium is a set of symptoms including an inability to focus attention, mental confusion, impairments in awareness, time and space, and perhaps hallucinations. It often has a fluctuating course and it can follow head trauma, stroke, drug withdrawal, hypoxia, hypoglycemia, physical illness or almost every type and use of opiates and benzodiazepines. Delirium is probably the single most common disorder affecting adults in hospitals and occurs in 30 to 40% of elderly hospitalized patients and up to 80% of intensive care unit patients. Treatment is to the underlying disease causing the delirium. Cognition, or the adjective form cognitive, Latin for knowledge, the process of acquiring knowledge through thinking and learning, pertaining to the mental activities of thinking and learning. Dementia, ment is mind, D is without, and ia is a condition. Chronic, progressive, and irreversible loss of the mind's cognitive and intellectual functions. Hallucination, hallucin is imagination. Ation is process, perception of an object or event where there is no such thing present. Iatrogenic, iatro is physician, gen is producing, ic is pertaining to, an unfavorable response to medical or surgical treatment caused by the treatment itself. Lewy body, after the scientist Frederick Lewy, abnormal cells seen in a form of dementia. Death and dying. Death is inevitable. Just as fetal life in the womb is a preparation for birth, living and aging are a preparation for death. You can prepare for death in different ways, most of which are done with your family's involvement and many of which require legal assistance. Medical issues are clearly significant in the process of dying. Your views on the types and extent of medical treatment you wish to have during the process of dying should be clearly stated. This is done through an advance medical directive, which consists of two documents: the medical durable power of attorney, in which you appoint someone you know and trust as your agent and authorize that the person to make medical decisions for you when you can't; a living will, in which you provide a set of instructions detailing what treatment you do and do not want in terminal illness, including hospice treatment. If there are special instructions such as do not resuscitate, these must be stated clearly. It should also include a Health Insurance Portability and Accountability Act authorization. It enables your agent to receive the medical information about you that's necessary for making decisions about treatment. This is needed because HIPAA imposes tough privacy of medical information rules on doctors and hospitals. Your primary care doctor should have a copy of your advanced medical directive and have read the document with you. This document should be part of your medical record. In some states, a document known as Physician's Orders for Life-Sustaining Treatment is now available. This formal document is effectively a physician's order statement that is based on the patient's current medical condition and wishes. It has specific sections that list the patient's wishes for cardiopulmonary resuscitation, medical interventions, and artificially administered nutrition. It's become a valid, durable component of the patient's medical record that health professionals must obey. The process of dying, rather than the death itself, is of concern to most elderly people. Dying should be dignified and free from physical and emotional pain. A hospice provides palliative care and provides for the emotional and spiritual needs of terminally ill patients and their loved ones at an inpatient facility or at the patient's home. Palliative care is designed to provide pain and symptom management to maintain the highest quality of life for as long as life remains. Just as the moment life begins is controversial, there is no universally accepted moment of biological death. In most states in the United States, death is now defined in terms of brain death, when there is no cerebral or brainstem activity and the electroencephalogram is flat for a specific length of time. Two other conditions involving brain damage and loss of brain function cause medical difficulty and should be addressed in your living will. Persistent vegetative state, PVS, Occurs in people who suffer enough brain damage that they are unaware of themselves or their surroundings, even though their eyes are open, yet they still have certain reflexes and can breathe and pump blood because the brainstem still functions. Even reflex events like crying and smiling in the sleep-wake cycle can be seen. With medical care and artificial feeding, patients can survive for decades. Minimally conscious state is a condition of severely altered consciousness in which minimal evidence of awareness of self or surroundings is demonstrated. There is inconsistent communication or command following. However, positron emission tomography scans of MCS patients show cortical function when their loved ones speak to them. They are more likely to improve than our PVS patients. Advanced Medical Directive is a legal document signed by the patient dealing with issues of prolonging or ending life in the event of life-threatening illness. Antioxidant, okay, we discussed that earlier. Death, Old English, to die, total and permanent cessation of all vital functions. Free radical, we discussed that earlier. Heredity, hereded, is inherited through genes. Idity is state or condition, transmission of characteristics from patients to offspring through genes. Hospice is Latin for lodging, facility or program that provides care to the dying and their families. Palliative care, palliat is reduce suffering, care to be responsible for. Iv is nature of or pertaining to, care that relieves symptoms and pain without curing. Vegetative, vegetate is growth. Iv is nature of or pertaining to, functioning unconsciously as plant life is assumed to do. Okay, and there we have the chapter on geriatrics.